Adipose tissue dysfunction, a consequence of SARS-CoV-2 infection. Obesity is an independent risk factor for severe and long COVID-19. The adipose tissue dysfunction observed in SARS-CoV-2 infection, with consequences such as metabolic disturbances and inflammatory responses, are similar to those found in patients with obesity and/or diabetes. Recently, various studies have shown the initiation of cardiometabolic disorders after COVID-19 infection, whose underlying mechanisms are unknown. Proposed factors involved in the onset of metabolic disorders are chronic inflammation, insulin resistance, viral persistence. Adipocytes and macrophages are the main SARS-CoV-2 target cells within the fatty tissue in the severe disease setting. In particular, adipocytes could act as a container of viral particles, especially in the long COVID setting. Possible entry mechanisms in mediating SARS-CoV-2 infection of the adipose tissue, apart from ACE2 receptors, are CD147 and neuropilin-1. Advanced research on these receptors has shed conflicting results. So, it is required to accelerate this investigation process to develop the appropriate therapeutical tools to prevent adipose tissue infection. In this regard, metformin has antiviral, anti-apoptotic, and antioxidant properties, so it could combat the adipose tissue metabolic dysfunction generated by SARS-CoV-2. At present, no effective treatments have been identified for long COVID. However, some approaches could be useful for specific populations, for example, fatigue, coenzyme Q10 D-ribose, neurological symptoms, low-dose naltrexone. The population of patients suffering from cardiometabolic disorders is rising. In consequence, it is urgent to optimize the management of these conditions to ameliorate the burden on the health care system.